You have 3 minutes.
Thank you. Chairperson, Deputies and Senators, Inclusion Ireland welcomes the opportunity to be here today to discuss this very important issue. The issue of bullying in schools continues to be an important issue that arises in our advocacy work in Inclusion Ireland. According to research, children with additional needs are 2 to 3 times more than their peers likely to experience bullying. The UN also points out that children with disabilities are 6 times as likely as other children to experience violence and abuse. This is especially true for children with psychosocial or intellectual disabilities. The bullying experienced by children in schools must be seen through the prism of general attitudes towards people with disabilities in Ireland, the absence of inclusive education systems, and the importance of children's mental health supports. One important aspect to consider on bullying is attitudes to people with disabilities in Irish society. For example, the National Disability Authority have reported that 28% of the public agree that children with autism or an intellectual disability should not attend the same school as their non-disabled peers. Addressing the negative attitudes towards children with disabilities must form part of the response to tackling bullying of children with additional needs. Northern Irish research illustrates that children with additional needs themselves felt they were bullied because they were different and that the bullying was related to their disability. Inclusive education in societies are important factors in addressing bullying, as research shows that isolation from peers is a risk factor for children with additional needs to being bullied. The NDA proposed 5 guiding principles to underpin a framework for schools to ensure that their school becomes a place where staff and children are happy and safe from bullying. And these are a rights-based approach to protect children from bullying, to govern and underpin principles and practices, systemic interventions, inclusive processes, education and training, that's for both pupils and staff, and leadership training and communication. This framework shares many of the common principles with inclusive education itself. Children's mental health services are a key part in supporting children with disabilities who've been bullied. It's worth noting that 35 to 40% of children and adolescents with intellectual disabilities have mental health difficulties during their life. This is 5 times greater than the general population. At the same time, CAM's intellectual disability services are virtually non-existent. To conclude, the following actions can be undertaken to address bullying and to support children who've been bullied that have additional needs. The government must engage in a public awareness campaign on reducing the stigma around disability in general. The government must invest in inclusive education. This results in better short and longer term social outcomes for children with additional needs, such as maintaining positive peer relationships and better social development into their later years. Continue the improvement of therapeutic supports by providing speech and language and occupational therapy within education settings where required. And finally, we'd ask that government invests in child and adolescent mental health services, especially CAM's ID services. Thank you, Chairperson.
Thank you very much, Mr. O'Connor.